Hello YouTube, this is Dr. Vibes, a learning point. In this video, we will study about chronic immunothrombocytopenic purpura. What does chronic word imply? The chronic word implies that this disease has progressed to a later phase and it is not acute anymore. Okay. What does immuno word imply? The word immuno implies that in this disease or this condition, autoantibodies are produced against the glycoprotein receptors present on the surface of platelets. So as antibodies are involved, immune system will be involved. What does thrombocytopenic means? Penia means decrease in the count and thrombocytopenia means platelets. So decrease in the platelet count. It means decrease in thrombocytes. And what is purpura? Because there is decrease in the platelet counts, this implies that it is a bleeding disorder. Hence, you will see some petechiae which is formed under the skin. This is what immunothrombocytopenic purpura in the chronic stage means. Now, let's discuss about the pathogenesis of chronic ITP. First, what is going to happen? First, there will be development of autoantibodies against the glycoprotein receptors present on the surface of platelets. What are these receptors? Glycoprotein 2b and 3a. One more thing to point upon is that these autoantibodies are IgG type autoantibodies. Okay, so first there will be development of autoantibodies against the glycoprotein receptors on the surface of platelets. Now you may ask the question that why these autoantibodies are formed. So there must be some reason. So there are two reasons, a primary reason and a secondary reason. Primary reason states that this is idiopathic, the cause is not known. And the secondary reason states that there might be HIV infection, SLE or systemic lupus erythematosus or B-cell neoplasm. So these can be the secondary causes. Now, after the antibodies have been formed, the platelets will be coated by these antibodies. So coating of the platelets by these autoantibodies. Okay. Now these platelets which have been coated by the autoantibodies will be engulfed by the phagocytes, particularly the macrophages. So the phagocytes will engulf these platelets. One more thing to ponder upon here is that the macrophages will consider the Fc portion of the IgG antibodies as their opsonins. Hence, they will phagocytize it and this process will be easier. Next, after the engulfment of the platelets has been done by the phagocytes, there will be extravascular destruction of the platelets within the macrophage or the phagocytes. Finally, what is going to happen? There will be destruction of the platelets, so there will be decreased platelet count, correct? Next up, what is going to happen? To compensate this decreased platelet count, there should be an increased platelet count, isn't it? So there will be acceleration of thrombocyte synthesis, correct? Now, who produces thrombocytes? Megakaryocytes, isn't it? So prolonged acceleration of these thrombocytes will exhaust the macrophages. Prolonged acceleration will exhaust the platelet production by the macrophages and antiplatelet antibodies are formed against the megakaryocytes. And antiplatelet antibodies will damage the megakaryocytes. And the megakaryocyte will produce defective platelets. So immature megakaryocytes are formed, which is going to release defective platelets. Ultimately, there is going to be decreased platelet count. Okay, and why I have written continuous decreased platelet counts? The continuous word implies here that the disease has a chronic course. The disease has progressed now. Because of the decreased platelet count, you will get to see moderate to severe thrombocytopenia. Why have I written moderate to severe thrombocytopenic purpura? Because see, the decreased platelet count initially was a mild case. Now this has progressed to a moderate or severe case. So this is the pathogenesis of immunothrombocytopenic purpura. That means ultimately there is a decreased platelet counts which has occurred due to the autoantibodies development against the glycoprotein receptors present on the surface of platelets.